Welcome to Mental Health Resilience for Nurses, Knowledge Byte 1. Knowledge Byte 1 Outline. The importance of mental health and well-being are physical, occupational, and social effects, magnitude of problem, prevalence, and incidence, stressors, general, HCW specific, and COVID-19, stigma, myths. Knowledge Byte 1 Learning Outcomes. After working through this Knowledge Byte, you should anticipate the importance of mental health, understand how mental and physical health interact, understand how mental health and occupational well-being interact, know how common mental illness is, recognize stigma against mental health, and be able to bust myths about mental health and illness. The importance of mental health and well-being. No health without mental health. Mental health is connected to all domains of well-being and bidirectional. The importance of mental health and well-being. Conditions between mental health and physical health. Mental illness has a higher rate of disability and mortality. Conditions example myocardial infarction and diabetes have higher risk of depression. Poor mental health may reduce treatment adherence for other chronic conditions. It leads to overall poor health conditions, increased healthcare utilization, and associated costs. Low socioeconomic status is a common risk factor for both mental disorders and other non-communicable diseases. The importance of mental health and well-being. Conditions between mental health and occupational well-being. About a third of the United States workforce has mental health or substance abuse disorder. About 80% of people with depression have some level of functional impairment. And 27% report serious home and work challenges as a result of depression. They have 4.8 workdays missed and 11.5 with reduced productivity over 3 months. Depression affects workplace productivity across diverse countries. South Africa has severe depression and anxiety, and a reduction in personal income of $4,789 per adult per year, and a national annual productivity loss of $3.6 billion. Prevalence, the general population. 1 in 8 people worldwide live with a mental disorder. According to the World Health Organization in 2019, 301 million people live with anxiety disorder and 280 million people with depression. The SASH overall lifetime prevalence indicates anxiety disorders at 15.8%, mood disorders, it was 9.8%, substance abuse disorders 13.4% and 30.3% of any disorder. Prevalence, healthcare workers. Even pre-COVID-19, mental disorders, including mood, anxiety, and sleep disorders, were more common among HCWs. With COVID-19 pandemic, severe emotional and physical distress for HCWs. From studies across 21 countries, the prevalence for depression was 21.7%, anxiety 22.1%, and PTSDs at 21.5%. This also includes insecurity, fear, and extreme working conditions. Stigmas associated with mental health and well-being. Mental health and illness are poorly understood. Get over it. It's all in your head. It's not real. It's the devil or demon's work. Stigmas keep people from accessing care. Stigma from community, family, friends, workplace, self, and healthcare providers. There are misconceptions about treatment options and are vilified in popular culture by using terminology like basket case, nut, or crazy. The myths about mental health and well-being. Mental illness is a sign of weakness of character. People with mental illness cannot work. All people with mental illness are violent, and all violent people have a mental illness. Mental illness cannot be cured or get better. People with mental illness should just pull themselves together.